Hello everyone and welcome. My name is Olga Sergeyevna Levchenkova and I'm a pharmacology teacher. This video is about physiological roles, uses and safety of vitamin A and vitamin E. Let's dive right in. Vitamin A is called retinol. An adult needs to consume 900 microgram of retinol equivalent per day. It's approximately 3,000 international units. As for beta-carotene, precursor vitamin A, it's 5 milligrams. Among the top 3 foods containing the highest amount of retinol are beef liver, cod liver, and other fish livers. Fish oil is also a rich source of vitamin A. Carrots, sweet potatoes, and other yellow-orange vegetables, berries and fruits are sources of beta-carotene, a vitamin A precursor. Vitamin A preparations include ester forms, retinyl acetate and palmitate, which are hydrolyzed in intestine to retinol. Active forms of vitamin A are alcohol, retinol, aldehyde, retinal, and the highest active retinoic acid, which interact with nuclear retinoic receptors, results in modulation of protein synthesis. The vitamin name retinol comes from Latin word retina, and the first biological role of retinol is associated with retina, the light-sensitive tissue in the back of the eye. It's photoreception, participating in visual pigment formation, rhodopsin of rods for dark adaptation, and iodopsin in cones, responsible for color vision. That's why uses for retinol include night blindness. Furthermore, in ophthalmology, retinol is indicated for xerophthalmia, its cornea dryness, and keratomalacia, cornea softening. These indications are also associated with the following biological role: maintaining the integrity and differentiation of the epithelium, of the skin and mucous membrane like of GIT and respiratory tract. Vitamin A increases the rate of tissue regeneration. It's biostimulant and can be a component of complex therapy for some skin diseases, erosive and ulcerative gastrointestinal problem. Besides, retinol support immunity, which leads to increased phagocytosis, improved mucosal barrier function, increased synthesis of interferon, lysozyme, and immunoglobulin A, protecting against infectious diseases. Therefore, it's indicated for people who are frequently ill. It's known that a lack of vitamin A in food inhibits the growth and development of the body, including intrauterine development. Therefore, one more important role is maintaining the growth and development of the skeleton. A few words about retinol derivatives retinoids. They act on nuclear receptor sensitive to retinoic acid. Retinoids are used in dermatology and cosmetology. There are topical retinoids like adapalene and tretinoin, and for systemic action orally administered isotretinoin. The primary function of retinoids is to normalize epithelial cells and suppress sebaceous gland function, reducing their size. Therefore, they are used in the treatment of acne. Since retinoids block pigment transport to melanocytes, they are used in cosmetology to correct age spots and also as anti-wrinkle agents, because under their action, more collagen, elastin, and hyaluronic acid are formed. However, retinoid use requires caution. It's recommended to start with the lowest concentration, not every day, and to use products with SPF protection during the day. Otherwise, the risk of adverse reactions such as dryness, redness, and peeling skin becomes more. Another possible risk of retinol use at high therapeutic doses is hypervitaminosis A. Manifestations include increased intracranial pressure with headache and vomiting, bone and joint pains, liver dysfunction, vision disorder, dryness and ulcerative of oral mucus, peeling lips and skin, especially of the palms. This requires immediate discontinuation of all vitamin A supplements and food high in vitamin A. Vitamin E can be used to reduce toxicity of vitamin A. Excessive vitamin A intake during third 12 weeks of pregnancy is risky due to teratogenic effect. When multiple malformations, abnormalities may develop, women should stop retinoid use at least 1 month before planned pregnancy. Next vitamin, vitamin E, Tocopherol. Its main preparation is alpha-tocopherol. The daily requirement for tocopherol is 15 mg for adults. Food particularly rich in vitamin E include vegetable oils, sunflower seeds, almond, spinach, avocado. Vitamin E acts as antioxidant. It protects unsaturated lipids and fatty acids in cell membrane from lipid peroxidation. It's scavenger of reactive oxygen species. Protects low-density lipoproteins from peroxidation, important for atherosclerosis. In addition, it increases synthesis of antioxidant enzymes, catalase, glutathione peroxidase. For the last, vitamin E promotes the entry of selenium into the active center of the enzyme. Besides, vitamin E protects erythrocytes from oxidative damage that leads to hemolysis. Therefore, it may be used for treatment of some types of hemolytic anemia. But mostly vitamin E may be given in confirmed vitamin E deficiency. I would like to mention one more role of vitamin E associated with its name. Tocopherol from Greek means to bear offspring, to bear children. Actually, it stimulates the synthesis of pituitary gonadotropic hormones. Therefore, it has been promoted for threat of miscarriage, recurrent abortion, disorder of spermatogenesis, but without convincing evidence of benefit. About safety of tocopherol. Vitamin E toxicity is rare, but patients taking extremely high doses, megadoses of vitamin E from supplements may develop it. Manifestations are muscle weakness, fatigue, creatinuria, but the most typical and harmful, risk of bleeding, due to inability to synthesize the vitamin K-dependent coagulation factors in the liver. For vitamin K and vitamin D, watch the video and don't forget to rate this video. Thank you.